Since 2012, PCORI has funded hundreds of studies comparing healthcare options to learn which works best given a patient's circumstances and preferences. Their funding has been focused on reliable studies that provide useful information that help people make informed healthcare decisions and improve patient care and outcomes. Patients, caregivers, clinicians, and other healthcare stakeholders are all involved in guiding the research funds. In 2017, the PCORI Board of Governors approved nearly $74 million to fund 7 studies comparing the effectiveness of different strategies for delivering palliative care. These projects that does deserve a huge round of applause. These projects will have far-reaching impacts on the field of hospice and palliative care, as well as patients and families we serve. Please join me in acknowledging Joe Selby, Executive Director of PCORI, for his organization's strong and unwavering support of palliative care research.
Good morning, everyone, and thank you very much, Tammy. Thank you to the Academy, I wanted to say that, for your leadership both in clinical care and in research. You've partnered with us for 5 years to help shape our research agenda in palliative care. I'm accepting this on behalf of Dr. Neeraj Arora, Senior Program Officer at PCORI, who is recovering from a surgical adventure. Very nicely, I'll say. It's his vision that inspired our funding announcement and now works to coordinate the research that we have funded and working with the principal investigators of these studies. I cannot imagine an area that is more patient-centered just in its essence than the area of treatment of advanced illness in palliative care. So we're very excited to have made an investment actually of over $150 million in this care. The majority of it, over 80 million, is investigator-initiated research, and we are still open, so if you are a researcher, think of us. We've proven that we're interested in this area. But the 7 studies that Tammy mentioned focused on 3 critical areas. One is identifying more efficient models for delivering palliative care. The second is informed decision-making and moving the process of care planning earlier in the life trajectory of patients with advanced illness. And the third is on comparative studies of ways to treat the symptoms that patients with advanced illness experience. These are some of the largest studies, mostly clinical trials, ever funded in this clinical area. They are noteworthy for the heterogeneity, the diversity of geographic locations, of the communities studied, and particularly of the diseases. We study a broad range of diseases. They're also noteworthy for the inclusion of caregivers as well as patients on the research teams and caregivers as subjects of the research. Very important topic. So last thing, if you would like to learn more about these PCORI-funded studies, tomorrow afternoon at 4:30, there's a panel that Neeraj was going to chair. He's not making it. One of the panel of investigators of these studies talking about the practical aspects of implementing large pragmatic studies. So again, thanks very much on behalf of all PCORI.